Hello everyone, I am Dr. Soumya Das, Associate Professor from Noida Institute of Engineering and Technology, Greater Noida. I am from Pharmacology branch and will discuss dealing with the subject Human Anatomy and Physiology with code BP101T. And our today's topic is classification of joints, its movement, different type of movements and its articulation. Okay. So, hope you all are doing very well. Keep reading, we will start our today's lecture. So, this is the classification of joints. In our previous lectures also we discussed about the skeletal system and its different class or the classification. So, coming to joints, today in our lecture we discuss about the different type of joints and different movements, how our body or through these joints we can make it happen. So, I hope you know about the articulation. Articulation is nothing but the definition of making of joints where two bones get joined and show their movement. So, a joint or a place of articulation is formed where two or more bones come in close contact in the body, in any area of the body it may happen, and it attached to each other by the presence of ligaments, or sometimes there are some cartilaginous tissues or materials, or sometimes there is extracellular membranes which ultimately support in the articulation process from which the movement can be arises. Okay, students. So, when we are talking about joints, we have basically three different type of joints. First is the non-movable joint, second is considered as the slightly movable joints, and third is the freely movable joint. So, see its classification. The non-movable joints are also known as the synarthrosis. So, students, you have to remember these terminologies. Okay? Non-movable joints means synarthrosis, slightly or partial movement. If any joint or bony structure show, it will known as the amphiarthrosis, and the third one is the freely, at any direction it will show their movement or bending like conditions. So, it is known as the diarthrosis. It is mostly seen in the kneecap joint where there is a presence of synovial fluid which will ultimately provide a support as well as help this fluid in the movement of the bones, which is the humerus and the radius and ulna. Okay. So, we will see in detail in our next few slides. So, see the diagram, students. These are the joints. The first one I am showing you here is the freely movable or the synovial joint. So, see, this is the elbow joint, this is our elbow. Okay. You will see here the freely movement in any direction, extension, flexion, right hand, left hand direction. So, this is the proximal, we can say the nodular joint, or there is a presence of synovial cavity which is filled with the synovial fluid. Okay. And then there is the start of radius ulna in the lower side, in the upper side we have humerus bone. So, this is a very good example of freely movable joint which is the diarthrosis. And second, you will see the diagram of a spinal cord, or we can say the vertebral column. It is the slightly movable or the cartilaginous joint. Slightly movable means amphiarthrosis example. The example is spinal cord, or we can say the vertebral column. Then we have the third example is the fixed or fibrous joint. So, I hope from seeing this structure you will have a very good clear cut idea about this. These type of joints, that is the synarthrosis joint, non-movable joint, are located inside our skull where there are sutures like the parietal suture, occipital suture. Okay. So, these are fixed joints. These sutures will ultimately provide support and to the baby brain when the neonate or newborn will come in this world, it will the brain development happen, okay, as the child grows. Okay. So, this will provide, so this is fixed joints, not any type of movement is shown by this synarthrosis joints. Now, coming to the fibrous or one by one joints will go in detail, the fibrous or non-movable joint. So, see this structure, this is the skull area where you will see the dense fibrous connective tissue which ultimately show or make the we say the sutures. Okay, you will see these curved lines are the sutures, and in the A part these are sutures, and in the second B part there is a syndesmosis area which is also coming in the non-movable joint example. Here you will see the before the starting of tarsals, we can say at the ankle area of the leg there is a presence of ligament, which is the muscle white area is the ligament which fix the tibia and fibula bones. Okay, and this will provide the growth of the bony shaft or the bony structure, okay, during the growth of the kids. Okay. So, fibrous or non-movable joints, as the name depicts, no movement is allowed, or we can say sometimes very slight or rare movement can be seen. No movement is allowed during these bones. Listen students, if any slight or small movement is shown, this is the pathological condition. Okay. So, means the patient is not having their normal homeostasis. Okay, this is little bit different with the normal physiology. So, he or she should go and report or check to their orthopedic. Okay, students. So, fibrous non-movable joints, no movement allowed here, first thing. Second is they are held together by a thin layer of strong connective tissues which ultimately forms and named sutures in the brain. Okay. It is designed to allow the growth of the body. Its main prime function is to provide or give support as well as provide growth of that particular area. Like example, sutures which allow growth of the brain, the development of the brain. So, we have sutures, gomphosis and syndesmosis. So, we will deal one by one little bit. You will see sutures, first one. These are the hazy or zigzag structures. These are present between the skull bones, in between the sagittal suture. Sagittal suture is an example which you will see in between the two parietal bones. Two means the right hand side as well as the left hand side of your skull. The second is the coronal suture, and which is you will see the coronal suture in between the front and the parietal bone of your skull. So, these are the examples of sutures. Second, coming to the gomphosis. Gomphosis are the joints between the jawbone, okay, the upper jaw and the lower jaw, which is the mandible and the maxillae. As well as this jaw, you will see there is comprises of teeth. Okay. So, periodontal ligaments also present there which ultimately hold these joints, the upper joint, upper maxilla and the mandible together. Okay, these are joined by the presence of this periodontal ligament. Okay. So, the third one is the syndesmosis, and these are the joints formed by the fibrous band, and these ultimately holds sometimes two or sometimes more than two bones together with the presence of interosseous membrane. Inter means in between, interosseous membrane which is present in between the radius and the ulna in the hand, and in the leg we have tibia and fibula. Okay. Now, coming to the after immovable joint, coming to the slightly movable joints. Okay. See this diagram students, this is the vertebral column where you will see the intervertebral disc arrangement between each vertebrae is arranged in a sequential manner. So, the joint between each vertebrae is an example of slightly movable joint, and the another is the presence of cartilaginous pad where you will see the presence of interosseous in the bones, muscles, or sometimes we have the deltoid muscles which is found in the rib cage which provide the support and joining fixation of 12 pairs of ribs with the sternum. Okay. So, this is the joint between ribs and sternum we have costochondral joint and sternochondral joint in the diaphragm area of our chest, कह सकते हैं हम लोग chest area. Okay. So, here you will get an example of slightly movable joints. These allow some degree of or a very small fraction of movement between the two articulated or more than two articulated bones together. The articulation surface of these bones forming the joints are attached to one another by the presence of white fibrocartilaginous disc, which is also in the vertebral column known as the interosseous disc, yeah, intervertebral disc. For example, the primary cartilaginous joint, it will provide a growth plate which with the help of first sternocostal joint between the first rib and the presence of manubrium, which is the superior, most superior upper portion of the rib before the xiphoid process. Okay. So, ultimately the primary cartilaginous joint provide a growth of these the sternum area, which is the first sternocostal joint between the first rib and the manubrium. The second cartilaginous joint, which is the symphysis, and it will you will see this symphysis in the pubis area between the two pubis bones, which is the hip bones, okay, in the we can say the pectoral girdle area, and here intervertebral disc between the adjacent vertebrae is an also example of secondary cartilaginous joint, and the third example is the manubrosternal joint. Okay. So, these are all examples of slightly movable joints. Now, coming to the very important freely movable joint, or which is also known as the synovial joints. So, where in the elbow, in the kneecap, okay, we have this synovial cavity which is filled with synovial fluid. So, that is why the name is same as synovial joints. It is very freely movable. So, you will see this is, for example, if you are talking about the lower limb or the leg area, this is the humerus and there is an articulation of tibia and fibula in the leg area, or when we are talking about the elbow, there is we have femur and the tibia, what we say the radius and the ulna in the hand, and you will see these two border or the concave and the convex area is the articular cartilage, and again this is these two upper and lower side are the bones. This is a cavity like structure filled covered with the membrane known as synovial membrane, filled with the fluid synovial fluid, and this cavity is known as synovial cavity. Okay. And in between that there is a boundary, or we can say a capsular structure, which is the articular capsule. Okay. These joint cavity containing the synovial fluid, which ultimately make two articulated, or two means we have here three bones, which is the humerus, then we have humerus, radius and ulna if you are talking about hand. Okay. So, we have three bones which is articulated at the elbow and show their freely movement at any direction you want. Okay. So, these are lined with a synovial membrane, and these membranes secrete synovial fluid. The fluid lubricate these joints. The end of the bones are covered with a layer of smooth hyaline cartilage, and this hyaline cartilage ultimately provide a vast large range of movement of the bony structures. Then articular surface covered by the hyaline cartilage, and the presence of cavity is the hollow space. These joint cavities, the presence of the synovial fluid, the covering of the synovial membrane and the joint capsule are the very important or the characteristic features of these synovial joints. These bones are also attached by ligament, and these ligaments are required for the further prevention of dislocation during the normal movement. Now, coming to the classification of synovial joint. So, we have basically two good example. One is the ball and socket joint, and second is the hinge joint. So, you will see this is the hinge joint in the hand that I explained you just right now. We have humerus and this is the ulna. So, the presence of joint between the elbow area is the example of hinge joint, and in the leg area or the pectoral girdle we can say we have the ball and socket joint. The groove or the cavity is like ball, where the another bone articulation is like socket, which ultimately fix to this ball and show their movement at any direction. Okay. So, these are examples of synovial joint. You have to remember these two, ball and socket joint, students, and the second one is the hinge joint. So, see one by one. Ball and socket joint, this is the most important movable, most movable or mobile among all other joints we have read. Then it is a spherical sphere in one bone, which make a fit into cavity of another bone, and these joints are formed where the rounded head of one bone fixed into the hollow or cup like structure, or we can say the cup shaped socket of another bone, and it will ultimately provide the freedom of movement in any direction. Okay. Like in hip bone, okay, we have to move our leg in the circular rotational direction, in the upside, in the flexion extension condition. Okay. So, this is one very good or highest movable joint, that is the ball and socket joint, or we can say the hip joint or the shoulder joint. Shoulder joint is here, you will see how different directions or rotations I will show you. Then coming to the hinge joint, it is the movement across these joint in one axis. Okay. Hinge joint only provide the movement of the bones or the bony structure in a single direction, in a single axis, like the hinge movement of door and close. You will see in your home also, the door and the window will open at one direction. Okay. So, these are the examples of elbow joint or the knee joint, examples of hinge joint. Okay. Now, coming to the condylar joint. Condylar joint we have in the ankle, in the wrist area of our hand, where we have 8 number of bones you have gone through in our previous lectures. Okay, students. So, this is the oval shaped condyle, which ultimately fits into the socket of another bony structure, and this ultimately provide the movement in one direction only. Okay. And we have additional some rotational movement in another axis also, with the help of the presence of condylar joint in the wrist bone area. For example, temporomandibular joint. So, see the structure. This structure is like ball and socket type. Okay. Condylar. So, this is the arrow you will see here, student. These are the movement, axis of movement from this presence of condylar joint in the wrist bone you have. So, this is the scaphoid bone and this is the lunate, and above this we have just above the wrist bone we have the radius and ulna. Okay. So, the presence of temporal mandibular joint, we can give an example, or the presence of condylar joint in the wrist as well as in the ankle area of our leg, the two directional or the we can say two axis movement of the bones. Then we have plane joints, which show the articular surface of the flat, and only minimal gliding movement is possible in the plane joints, and its example is the intercarpal and intertarsals joints. Okay. I hope you remember about the intercarpal and intertarsals bone, which is there in our palm, okay, just below the phalanges area. Now, coming to the pivot joint, the one of here, what happened in the pivot joint? Remember students, one bone is fixed at their position or their plane of the surface, no movement is seen in that bone, fixed, and the another bone will have the freedom of rotation around the fixed bone area, and its example is the proximal and distal radio-ulnar joint. Radio-ulnar joint means where you have both the bones, radius as well as the ulna in our forelimbs. Okay, so see this diagram of pivot joint, you will see the concave structure, and this is the apical structure of the another bone, and this is how this is the humerus, and how the presence of this concave and the radial structure, the radius and the ulna is joined together and show its pivot movement. Then we have ellipsoid joint. Here oval convex, or it is sometimes said as the oval convex male surface which fits into the reciprocal, means opposite concave female surface of the adjoining means nearby supportive bone, and it allows the movement in two direction, or we can say two axis. You can get a clear cut idea by giving an example of flexion, extension. Flexion means how much I can close our hand or leg, or extension means how much angle it will begin, okay, it will form, how much I can extend my hand or leg in a direction, certain direction. And the another example is the adduction and abduction. So student, adduction means to like see me, this is the adduction, okay, how I move my hand in the trunk area of my body, okay, and this is abduction, away from my body, okay, the trunk area. This motion is abduction, this motion is adduction. And here example of ellipsoid joint is the wrist joint, metacarpophalangeal joint, and atlanto-occipital joint, etc. Now coming to the last one, and this is the saddle joint. It will show the movement or the articulation between the surface which are reciprocally, means just opposite, means it is showing the concavo-convex joint. Example, its saddle joint is first metacarpophalangeal joint, and another example is sternoclavicular joint, sternum cavity and the clavicle of the shoulder blade, okay, shoulder, it will show the sternal clavicular joint. So the rotation movement or the up and stretching movement of our shoulder or the hand is coming under the saddle joint. So see this diagram, again you will have either concave structure, this is saddle which is fixed on this concave structure, and again in the wrist area we have saddle type of joint which will show the two axis rotation. Now movements allowed by synovial joint. So we have three different basic type of movements, one is gliding, second is angular movement, and the third is the rotational movement. Gliding means students, here one bone across the surface of another bone, like turning or twisting of our leg. What happened? Like I am twisting my hand, what will happen this time? Here we have humerus, then we have the elbow, and here we have radius and ulna. Okay, you know at the thumb area we have the radius bone which is shorter and thicker than the ulna bone. So when we rotate my hand, what will happen? This radius and ulna will show the overlapping or the gliding movement, means one bone across the surface of another bone. The second movement is the angular movement. Here the movement change the angle between the bone, like in flexion and extension. This is the angle, you will see here. I am decreasing the angle of my hand, I am increasing the angle of my hand, and I will show the maximum 180-degree angle. Okay, this is maximum extended my hand. Okay, and the third movement is the rotation movement. Here you will see the movement around the bone along the axis. Rotation means you will rotate your hand or leg at any direction. Okay. Now coming to the gliding movement. Here you will see in the picture like my hand. Okay, here we have the wrist bone, then we have the metacarpals, then we have phalanges. I will rotate my hand with the help of this. What is this? The carpal bones in any direction, to and fro, right and left direction. Okay, so the flat surface of two bones which is there in the wrist bone, which will provide a movement or the gliding movement across the each other. So, gliding occurs between the carpals and between the articular process of the vertebrae, means this type of movement you will see in the vertebral column also during sleeping, sitting and standing. After lying position we have sit and stand up. So, this type of movement bending in the vertebral column is there because of the presence of gliding movement, and the ability of these bones, these vertebrae to prove this gliding movement, show this gliding movement, and then in the tarsals also. The another is the angular movement, here where we can change, we are able to change the angle of our structure, bony structure. So, we have flexion, extension, dorsiflexion and plantar flexion, then we have adduction and abduction. These are different angular movements. So, in the picture it is very clear, see one by one. Okay, students, this man is able, this is my normal neck. What will happen if I move my head towards my chest? It will decrease the angle and show the flexion. And if we move my head like backward direction in the posterior end, how much extent I will move my head downside, this is showing the hyper extension. Okay, the flexion, extension, hyper extension. Okay. So, this is one movement. The second is, you will see in the hand again the flexion and the extension. How much with the presence of wrist bone or the what we say here, the carpals. In the hand we have carpals, in the leg we have the tarsals. How much maximum movement we can show. Then in the leg you will see here, if we move the leg away from our tongue, it is known as abduction, ABDUCTION, abduction. If we move back our leg or hand towards my body, main body or the trunk area, it is known as the adduction, 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 abduction. Remember this, do not confuse students. Okay, then in the leg you will see the rotational, like in a hand, right hand rotation, left hand rotation, okay, clockwise, anti-clockwise you have. Then see this leg area or the palm. Okay, this is like, this is my palm. If I invert this my body area, so in the palm side this is termed as eversion, and if it will showing this movement, inversion, eversion, inversion. Remember this in the leg also, eversion, inversion. Okay, then again the movement of hand and leg above and below, this is dorsiflexion and this is plantar flexion, dorsiflexion, plantar flexion. Okay. So, these are very important movements which is only be possible because of the presence of different type of joints or the articulations which is there in the skeletal system. Okay. And the presence of some of the important muscles, skeletal muscles also. So, these are some important movements. Rotation, movement of my head from right, up side, back side, okay. Turning of bone around its own axis, like example is in the atlas and axis vertebrae C1 and C2, then hip and shoulder joint. Then we have the circumduction, in the rotation in the circular direction, movement of a body, any body region, maybe we can say the pectoral girdle region also, in a circular manner, right hand side clockwise and anti-clockwise side direction, in which one end, rest half of the body remains fixed, stationary, while the other end of the body makes a complete circle either in any direction. It allows the sequential combination of flexion, adduction, extension and abduction of joints. So, this is all about today's students. Keep reading, stay updated. Okay, see you in our next lecture. Bye bye.